My name is Karen Dutton and I'm a registered nurse and recently revalidated, and I started my nursing career in palliative care. So this at this point in my career, this 2-year project has been a gift and a real privilege to be involved in. So the Let's Talk Bereavement project is actually a 2-year project that's funded through the NHS Charities Together. The project started when I came into post last year in February, but it actually resulted from a bid for funding submitted by bid partners from the Cumbria Bereavement Support Partnership. Now, this is a collaboration of statutory and third sector organisations who provide support services across Cumbria for the bereaved. And actually, for me, they are invaluable. This, although they came together as a result of the pandemic, actually they are my support. You know, they are my network that I feed into when there's any issues, and they give me expert advice and help me to connect them with others. So it's been a marvellous partnership to be involved with, and they meet once a month. So if you are from any bereavement support roles or organisations, please, let me know, and I will link you into the partnership, because that is still going strong with new members joining, most months, to be perfectly honest. Okay. So the drivers for the project, as you can imagine, the pandemic was likely and did cause, was traumatic due to a range of factors. And as we know, the social distancing meant that there was an inability to be with loved ones and to use our normal coping strategies and pre-bereavement, going and saying goodbye to people, saying what we wanted to say and everything, supporting each other in that physical environment was all taken off. But a lot of people's loved ones died suddenly, and it was wrenched from their lives. So those bereaved as a result of those type of traumatic, sudden and unexpected deaths are likely to, need more additional bereavement support. Now, when I say additional bereavement support, I don't necessarily mean bereavement counselling, and the formal bereavement support services were totally overwhelmed and continue to be overwhelmed by demand. There's an increasing demand going on. So, there was recognition through the Bereavement Support Partnership that there was a definite need for improved bereavement support to prevent longer term mental health consequences, because bereavement is, and particularly unresolved grief can lead to the adoption of detrimental coping mechanisms such as increased alcohol, increased drug taking, and then the associated community and family disruption. When people are in intense emotional pain, they're looking for relief, and this is why this occurs. The other thing to remember is if people adopt these detrimental coping strategies, then we're brewing up even more mental health and physical health problems for the future in a health and social care sector that is already under immense pressures. So, this is where it was all linked to. So the funding bid was submitted to NHS Charities Together, and what happened was some of the bid partners, Samaritans West Cumbria, Hospice at Home West Cumbria, Child Bereavement UK, supported by CLIC, who have kindly supported this session today as well, all came together to put the bid. And as I say, the funding is through NHS Charities Together. So although I'm currently employed within the NHS, I'm actually hosted by the NHS. So the aim of the project was to encourage more conversations about death and bereavement, because strangely enough, there's only two things that are guaranteed in any of our lives, and that is that we're born and we die. But unfortunately, when it comes to death and discussing death, bereavement, grief, we're very unprepared for that. We feel uncomfortable with that. And we need to start normalising those conversations, because it's important. And, some areas of the world and different communities do it well. But in the Western society, particularly, we tend to struggle with that. So the rationale was to enable people in North Cumbria, anybody who needed bereavement support, to be able to access this. So the activities identified for the project were to provide access to core and targeted training about bereavement and to develop skills and provide tools to enable people to be more confident in providing low-level bereavement support within their communities. Now, low-level bereavement support isn't counselling, this is literally people having the confidence to, discuss how they're feeling, how they're grieving, how it's impacting on them. To process their grief with support in the way they need to as an individual, and also be able to feel that they could speak to people and process it in their time frame without feeling judged. And that is a struggle for some people. And if you are interested, I discuss that in detail in the core. When we talk about providing tools, all our sessions, provide additional, tools, links, attachments to other resources that may help you support others or yourselves. So in the bid, what the training was identified was the project lead, in this case myself, to co-design with partners and deliver at least 100 online course sessions during the 2 years of the project. Now, we're actually ahead of that. I think we're on over 120 now, and we've still got 7 months of the project to actually run. And initially, it was supposed to be a 1-hour session, and that is what was developed with partners, and the core skills is about literally the fundamentals. What is grief? And we look at the uniqueness of grief and what inhibits people grieving in the way that they need to. And we talk about the judgments sometimes made and the society's messaging around grief. But as a result of the feedback from people attending, as more people shared examples, and there was more examples to actually demonstrate, real life against the theories that and the models that I talk about, actually we were asked to do it for an hour and a quarter, and then it went to an hour and a half. So actually, as a result of feedback, this is now, any Let's Talk Bereavement sessions are actually 90 minutes, apart from the Bereaved by Suicide, which is delivered by Every Life Matters in Cumbria, and that is a 3-hour session. So the next aspect of the project was 50 targeted sessions. Now, these were initially thought to need supporting grieving children, which is a need, and we that was developed with Child Bereavement UK and is being delivered weekly, and that started last October. And then there was Bereaved by Suicide, that was high. Unfortunately, as you may know, the rates of suicide in Cumbria are increasing, and so are the related people bereaved by that. And so Every Life Matters has put together a pack to deliver Bereaved by Suicide. They're doing that every other month, but if demand increases, then there is some funding to actually do that more often. Bereaved and dementia was the other one. But again, the beauty of this project is that people have engaged with me and been very, very supportive and given me effective feedback. And the sessions, people have surprisingly shared, things within the session that have also shaped the second year of this project, because unfortunately, we're not going to be doing bereavement and dementia, because as a result of the core feedback on core sessions, it became very clear that the one slide around anticipatory grief had highlighted that there is little understanding or recognition of anticipatory grief, either in ourselves or families, or other people. Particularly prevalent when you think about when you're looking at colleagues and you think, oh, they're in one or they're having an off day. Very much people reporting that actually they felt they hadn't heard of anticipatory grief before, but actually they recognised that that is what they were going through, and that the feeling of this anticipatory grief was more intense for some than actually the bereavement itself, and yet you're getting on with your lives on the background of anticipatory grief without actually realising that's what you're experiencing. So that became a focus of the second year of this project. So instead of bereavement and dementia, we're doing anticipatory grief in adults, which I deliver every week. And my colleague in Child Bereavement UK, one of the big partners, has actually developed a anticipatory grief in children and young people and the impact on family units. So originally, the funding for training was to be delivered to those working or volunteering in North Cumbria, and with a particular emphasis on areas of deprivation and vulnerable groups, because it has been shown that these particular groups do not access bereavement support, often for many reasons, but usually because they don't know how, or there's rural access issues and everything. So that's where the project initially stood. But as I say, it's been a privilege to be involved in this because the engagement with the project has been absolutely phenomenal. So the feedback, what's going on at the moment, for those of you that you don't know, is all of the sessions, because they're funded through NHS Charities Together, are free. So all the sessions are funded, and they are now, because of the feedback of the first year of the project, available for anyone living, working or volunteering in North Cumbria. Now, there was a lot of discussion about whether it should just be open to the general public, but it was felt very strongly that if we're going to make an impact with this project in communities, then we need to get out there. So, the partners, people who have, participated in the training are part of the project. I can't make the changes myself. I'm sitting here just like I am now, training people, but I'm relying on them to feel confident enough to use the skills that they are gaining from the training to make a difference in their own lives and the lives of others. So we sent it out to, and opened it out to everybody. But because I deliver the sessions on a weekly basis, I only have 8 people at the most on my sessions, more for the Child Bereavement UK, and there's more on the bereaved by suicide. But for my sessions, I only have up to 8. And for those of you who wouldn't be keen on going to something that's only got 8 people in, there's no pressure to participate if you don't want to. And I make that very clear at the beginning. So because there's spare funded places, I don't want to waste charity money that people have put all their efforts into raising for us and to make a difference. So there are, the people do express interest in the project and the associated training from outside the area, mainly the North East, South Cumbria and Lancashire. But, we've had somebody come from Oxfordshire, London, Sheffield, Manchester, all over the place, because they've heard about it. One organisation called Restorative, that covers restorative justice, wanted their staff to actually access it as well, because this is free across all sectors. So as I say, literally anybody can apply. So funded places are being taken up by those outside the areas when there are spare ones. So at the moment, our offer is core bereavement skills, which covers grief, the complexities and supporting others. Supporting grieving children is delivered by myself. Bereaved by suicide is delivered by Every Life Matters in Cumbria. And anticipatory grief in adults is delivered once a week by myself. And anticipatory grief in children and young people is delivered on a monthly basis at the moment. We only started that this month. Depending on demand, that may be increased. Okay. So the outcomes so far, and this is variable because I'm doing weekly training, so these literally change on a weekly basis. So the number of people that have come through this suite of training across the Let's Talk Bereavement is over 500 people. And as I say, we mostly only do small groups. The number of organisations accessing sessions, and these are small groups, charitable groups, to big organisations like Sellafield, are 120 across all the sessions. Now, the initial prediction when the bid was put together was that they thought they might have a reach of about 40 to 50. So you can see that because of the engagement and collaboration, which has, as I say, has been phenomenal and really inspiring for me as the project lead, has led to more people knowing about it. And when I send out a help email saying numbers have dwindled, within a week those numbers are going back up again, and that is only as a direct result of the support I get from the participants that have been through the courses. As I say, number of people who have accessed sessions from outside North Cumbria because of these unused funded places is over 60 and much more over 60 now. But as I say, they change on a weekly basis. What's been fascinating to me, as I say, I'm a registered nurse, but I've been moved into education in different guises over the last few years. But I have never been privileged enough to actually have such a wide range of people attending any sessions that I've taught. And they literally go from unpaid carers to specialist consultants and psychologists who are coming together in groups of 8, and they're all having exactly the same session. I'm not doing, groups for, medics or anything like that. People are coming together to learn together. And I think there's a richness in that. There's, as I say, close collaboration and support from the partners, but the Bereavement Support Partnership and the steering group that's made up of the big partners, plus public health leads, plus members of the public and third sector, have been absolutely phenomenal. When I've hit barriers, they've collaboratively used their networks to support me to get word out there or to look at different things, and feedback has shaped the sessions themselves. So, I'm eternally grateful for all those who've supported me. As I said, the whole idea of the project was to reach out to, deprived, disadvantaged areas and vulnerable groups. And it's been great to see people coming from those groups and organisations that support the homeless, drug and alcohol addiction, safeguarding, dementia, unpaid carers, older people, and the list goes on. We've also been privileged enough to have people share their lived experience, both in the sessions, but also involving members of the public in co-designing the targeted and getting their feedback. We've had staff and volunteers giving feedback from third sector, public sector and private sector, who have all accessed different sessions, and the feedback's been, really positive and strong. Now, I've told you what was expected of the project, but actually there's been some exciting and unexpected benefits, because, as I said, I sit within the NHS. I'm hosted by them, but actually I'm in a bubble. So the freedom to actually connect with a wide range of people and just be able to run with their feedback without going through a lot of the bureaucracy of organisations, to be perfectly honest, has been brilliant. And people from literally members of the public to chief execs have contacted me saying, Karen, can you help us with this? Do you know anybody of this? Because they see Let's Talk Bereavement and they know that I can connect people. So I do a lot of literally connecting networks, connecting people. I even had a national cancer charity contact me because they were looking at setting up a new service and wanted to know if any was going in Cumbria. So Cumbria is coming on the map around this. Engagement, as I say, there's just me. I have the support of other people, but it's only through the engagement of those coming through the project training that has helped shape the second year to make sure that we're actually tackling the need of our local communities. it's been wonderful to see us, the project influencing and giving people light bulb moments in other areas of the UK, starting increased discussions about informal bereavement support and how their areas, as well as our own areas, are doing that, and are we doing it well. There's a recognition of need as a result of the feedback through the project and starting conversations. Organisations, I'm getting contacted by organisations to actually have conversations and signposting to support around reviewing their bereavement policies and their special leave policies to actually recognise the complexities of grief and how that can impact on the workplace, because millions, and I think actually billions of pounds are spent or lost in the work, in employment, through grief, because it's not well supported. But what's been amazing is giving people permission to grieve. And that sounds daft, doesn't it? Why would you need permission to grieve? But you'd be astounded by the amount of people that come through these courses that have come because of their work roles or volunteer roles, but shared their personal experience of grief and actually said, I found this reassuring, Karen, because I thought I was grieving wrong. That's how, bad our judgments impact on people, because we often have a perception of what grief should look like, and when it doesn't, our interactions with those individuals can have really negative impacts on them. So what next? Well, things like this, it's important for me at the moment to keep the momentum. And, if you think the project sounds any good, or, or the training, please get involved, because the more people we can get through, I can't guarantee the training will go on after the end of the project. I'm working hard to put data together and reports to influence that, but I can't guarantee it. So I can guarantee these sessions are here till the end of January next year, but after that, we're not sure. So the more people we can get through, the better. I'm being asked to do community court talks, such as with the Rotary Club, or going to community events. And if you have any on, please could you consider inviting me? Even if it's a short talk like this, to just get the word out there. The assessing a need and scoping for train the trainer. Some organisations and group actually want to be able to continue the training after the project finishes, and are thinking about having their staff trained to deliver it, and the package that I've developed will go to them so they can continue that. As I say, I'm trying to influence local NHS and the councils, but I also support anybody who wants to set up bereavement hubs, cafes, by training the volunteers and the staff. I'm also in the process of supporting Cumberland FA for their youth workers and their wellbeing officers, who are finding themselves increasingly supporting young people that are grieving, as well as community grief, and I'm doing some work with them. But it's about the project being responsive to local need, and that's only been possible through the collaboration and networking of all of those I've previously mentioned. It's also about sharing what we're doing with other national and linking it to national bereavement initiatives, and really to build on current delivery. And I don't mean anymore, I haven't got the capacity to deliver anymore, and there are gaps, but those gaps will be identified in my final reports. So it's keeping the momentum up, so that's some of the feedback.